So the session we've done this morning, which was about tissue acquisition, about commissioning of drugs, and these are both really important because they're relevant to all patients with diagnosis and treatment of lung cancer. The first speaker we had was Peter Clark, and he is currently chairing the NHS England Chemotherapy Clinical Group, and that essentially oversees chemotherapies in the UK. And he talked a lot about NICE and what is the value of NICE. And we found some fascinating things. We found, for example, that the drugs budget for cancer treatments is £2.7 billion. It's actually the single biggest expenditure for specialised commissioning in the UK for NHS England. It's remarkable. We also learned interesting details about how NICE approved drugs, and interestingly enough, and perhaps surprisingly for lots of people, 85% of lung cancer drugs since 2015 have had a positive NICE appraisal. It's actually very high. There's only been 4 drugs since 2015 which have not had a NICE approval. And I think one reason for that is we've engaged very well as a healthcare community with our colleagues in NICE to help get appropriate drugs approved. Peter also talked to us about how NICE works, what a positive approval means, which means it has to be approved and funded by NHS England, but it doesn't mean more money. So if you have a new approval of a drug, something else has to stop. The other thing he then talked about other challenges, and there are challenges for NICE, challenges of workload, the number of appraisals, and the challenges of appraisals starting but then being terminated often by our colleagues in industry. So I think that was a fascinating insight into how NICE work and how we might engage more with NICE.